Right now, your entire arm, this limb that's capable of throwing a 90-mile-per-hour fastball, or intricately playing a piano, or just lifting your own body weight, it's actually physically hanging off your skeleton by a single, remarkably fragile biological thread.
It really is. I mean, it's wild when you actually think about it.
Right. So today on our deep dive, we are decoding the biological machinery of the human shoulder and arm. Our mission is to take a stack of detailed clinical anatomy sources and basically translate them into the engineering marvel that is your upper body.
Yeah, we're looking closely at the clavicle, the scapula, and the humerus.
Exactly. But we aren't looking at them as just dry, static bones in a textbook. We're going to break them down as this complex mechanical system of levers, floating platforms, and custom machined fully.
Which is really the only way to understand this region of the body, honestly. You just memorize bone shapes, you entirely miss the underlying genius of the architecture.
Yeah, the sources make that super clear.
Right. The entire design of the human arm is dictated by this massive evolutionary trade-off, which is basically the battle between mobility and stability.
Which is fascinating.
It is. Because if you look at your hip joint, for example, it is incredibly stable. It's a deep, secure socket. But because of that depth, your leg has a severely restricted range of motion.
Right. I mean, you can't exactly swing your leg in a complete circle behind your head.
Exactly. But your shoulder, on the other hand, is basically a golf ball sitting on a slightly flattened peak.
Because you need to be able to, reach up into a tree or scratch your back or swing a hammer.
Yeah, to achieve that almost limitless range of motion, the body just abandons the deep, secure socket model entirely. Instead, it relies on a kinetic chain.
A kinetic chain, yeah.
Right. A sequence of bones and muscles that work together to create a dynamic, constantly shifting foundation. I mean, it is an engineering tightrope walk. It's as delicate as it is powerful.
Okay, let's unpack this. Because to understand how that tightrope walk works, we really have to look at the anchor point.
The anchor point, yes.
Like, if I told you to build a mechanical arm capable of lifting 50 pounds, you'd probably just bolt it directly to the center of a heavy steel frame.
That would be the logical engineering choice, sure.
But human biology doesn't do that at all. Your entire arm is pushed completely away from your ribcage and held there by a single S-shaped strut. The collarbone.
Right. It is literally the sole skeletal connection between your axial skeleton, so your head, neck, and trunk, and the pectoral girdle, bone.
Which is terrifying if you think about it.
It is. Just imagine the physical forces at play there. Like when you do a push-up, the entire weight of your upper body is channeled from the floor up through your arms and into your core skeleton through that one thin bone.
Yeah, I was trying to visualize this while reading through the clinical notes, and the closest mechanical equivalent I could think of is like the strut on a high-wing airplane.
Well, that's a great analogy.
Or maybe the rigid brace of a suspension bridge, because the clavicle is there to just keep the shoulder propped away from the chest. Without it, your arm would just, collapse inward against your ribs.
Yeah, you lose all your mechanical leverage. And the S shape of the bone is actually critical to that function.
How so?
Well, a perfectly straight bone under compressive force will just snap like a dry twig.
Oh, right.
But that S curve acts like a biological spring. It allows the clavicle to compress and flex slightly to absorb shock.
Yeah.
And because it's a bridge transferring so much energy, the joints on either end have to be highly specialized.
So let's talk about that interconnection first, right at the center of the chest. The sternoclavicular joint.
Yes, the sternoclavicular joint. If you trace your collarbone inward to where it meets your breastbone, that joint is under immense pressure.
I can imagine.
So to keep the bone from grinding into the sternum, there is a dense fibrocartilage disc situated inside the joint space. It functions like a heavy-duty biological shock absorber.
And the sources say it's heavily reinforced by ligaments, right?
Exactly. Heavily reinforced, which allows for limited but structurally vital movements. Like it allows the clavicle to pivot so you can protract your shoulder forward, retract it backward, depress it downward, and elevate it towards your ears.
But the bone itself has to anchor all those reinforcing ligaments. And this is where the anatomy gets really specific.
It does.
Like the top of the clavicle, the superior surface that you can feel right under your skin, it's relatively smooth. But the underside, the inferior surface, it looks like it was chewed up by a dog.
Yeah, that's a good way to put it.
It's rough, textured, and covered in these jagged landmarks. I've got the terms here. The costal tuberosity, the conoid, tubercle, and the trapezoid line.
Right, and the underlying reason for that texture comes down to mechanical tension.
Yeah.
Ligaments are basically like thick steel cables. When they attach to a bone, they don't just glue onto a smooth surface. They need physical anchors to grip. So over years of those cables pulling and yanking on the bone actually responds by growing thicker and rougher at those specific attachment points.
Oh, wow.
Yeah, those tubercles and lines are the physical evidence of the immense stress the suspension bridge is under.
Wait, I have to pause here. Because if this one, relatively thin, S-shaped bone is the only physical bridge connecting the entire arm to the body and it's under constant massive stress.
Yeah.
Isn't that a massive design flaw? Like if the strut breaks, the whole system fails.
Well, it's a very logical critique. And clinically speaking, you are hitting on a major vulnerability. Clavicle fractures are some of the most common broken bones in the human body.
Really?
Absolutely. Because it's the solitary bridge. Any strong impact traveling up the arm from a car accident, a hard tackle in rugby, or just tripping and falling onto an outstretched hand, it transfers a massive shockwave straight into that bone.
Then the spring fails.
Right. The compressive forces overwhelm the spring-like S curve, and it snaps.
I was reading one of the sources that it's so fragile, a newborn baby can actually fracture their collarbone just from the compressive forces of squeezing through the root canal.
Yes, it happens quite frequently, actually, especially in complicated deliveries. And when the clavicle breaks, whether in an adult or a newborn, the visual result is immediate, and it's structural.
Because the bridge is gone.
Exactly. And because that rigid strut is no longer holding the shoulder away from the body, the entire suspension system collapses. The shoulder visibly sags in an anterior and inferior direction.
Meaning it droops forward and down.
Right. The structural integrity is just gone.
So how do you fix a collapsed biological bridge?
Well, it depends entirely on the physics of the bridge. If the bone snaps, but the two jagged ends remain lined up, you generally rely on a non-surgical approach.
Just a sling.
Yeah, you put the arm in a sling to remove the gravitational pull, and you let the bone calcify and heal itself. But if the impact was severe enough to misalign the pieces, or worse, if they start to puncture the skin, you have to open the shoulder up.
Yikes.
Yeah, surgeons will manually realign the bone and bridge the gap with a titanium plate and heavy screws, essentially mechanically holding the strut together while biology catches up.
Okay, so if the collarbone is this crucial rigid strut pushing the arm away from the chest, what exactly is it pushing against?
That's the perfect question.
Right, because if it just bolted solidly to another bone on the outside, you wouldn't be able to swing the arm in a circle. Evolution needed a way to anchor the arm without locking it in place. Which brings us to, honestly, the craziest piece of engineering in the upper body, the scapula.
The shoulder blade. It is a large, flat, triangular bone that rests over the posterior surface of your ribcage, roughly spanning ribs 2 through 7.
Okay.
And this is where the traditional concept of skeleton gets turned completely upside down.
Yes, the scapulo-thoracic joint. This totally blew my mind. You think of joints as two bones touching, right? Like a knee or an elbow. But the medial aspect of the scapula, the long edge sitting closest to your spine, it isn't physically attached to your skeleton at all.
It literally floats. The scapula glides over the posterior thoracic wall, suspended purely by a dense, overlapping web of muscle.
That is insane.
It is the ultimate example of dynamic stability versus static stability.
Dynamic stability, meaning the strength doesn't come from interlocking bones, it comes from active, constant muscular tension.
Precisely. If you were holding a heavy box in front of you, your shoulder blades aren't resting on anything solid.
They're just floating there.
Right. The only thing keeping your arms from ripping forward is the active synchronized firing of muscles in your back, pulling the floating platforms tight against your ribcage.
So it's basically a biological hovercraft. It can glide smoothly up, down, forward, and backward over the ribs, but it requires massive engines to do it.
Very massive impact.
And the sheer number of engines attached to this one bone is staggering. According to the text, there are 17 different muscles anchored to the scapula. 17.
Yeah, and to accommodate all 17 attachments, the bone has to be highly contour. It's not just a flat triangle.
Right, it's got grooves and bumps.
Exactly, it has distinct depressions called fossa, which serve as large surface areas for the muscle bellies to sit in. You have the subscapular fossa hidden on the front side facing the ribs, and the supraspinous and infraspinous fossae on the back.
And it has those two big projections too, right?
Yes, two prominent bony projections acting as leverage points. The coracoid process, which hooks forward like a bent beak, and the acromion, which forms the roof of the shoulder and actually meets the bottom.
Right, and 4 of those 17 muscles make up the famous rotator cuff, the subscapularis, the infraspinatus, the teres minor, and the supraspinatus. They act like active tightening straps, holding the arm bone into the shallow socket. But keeping track of the muscles that actually move the hover cuff itself is tricky. There is a great mnemonic trick from the sources for remembering the main movers.
Oh, let's hear it.
Okay, so for protraction, which is when your shoulder blades pull forward, like if you're throwing a punch, think of the P's and R's, pectoralis minor and serratus anterior.
Okay, nice. And for the opposite movement, retraction.
Right, pulling the blades back together, you use the R&T rhomboid and trapezius.
That's a really handy way to remember it.
Yeah, so you have these thick muscular cables actively pulling this hovercraft in every direction. But that extreme mobility seems inherently precarious to me. Like if this entire foundation relied on dynamic muscular tension, what happens when the tension fails?
Well, the pathologies are fascinating because they really represent a failure of the suspension system rather than just a broken bone. Take snapping scapula syndrome.
Snapping scapula, that sounds awful.
It is. So for the bone to glide smoothly over the rib cage, you have little fluid-filled sacs called bursae that act like biological grease.
Okay.
If those sacs become inflamed from repetitive overhead motions, like pitching a baseball or painting ceilings, you develop scapulothoracic bursitis. Or sometimes a benign cartilage tumor called an osteochondroma grows on the underside of the bone. In either case, the biological grease is gone, and the smooth gliding turns into a painful, audible snapping with grinding sensation every time you move your arm.
Grinding right against the ribs, yikes. And then you have structural failures, winging of the scapula.
Winging is a perfect demonstration of dynamic stability failing. And it's almost always a neurological issue, not a muscular one.
Oh, really?
Yeah, your muscles are engines, but they require electrical signals from nerves to fire. If a long thoracic nerve gets damaged, it can happen from a direct blow, or sometimes inadvertently during axillary surgery like a lymph node removal, the serratus anterior muscle loses its electrical signal. It simply powers down.
And without the serratus anterior actively pulling the shoulder blade flat against the ribs, the whole balance of tension is ruined.
Right. The unopposed pull of the other 16 muscles yanks the scapula out of position, causing the inferior angle of the bone to awkwardly protrude backward under the skin, literally like a small wing.
Wow.
It completely destroys the mechanical leverage of the arm. You can also see abnormal scapular function due to dysplasia, which is a structural deformity of the bone itself.
How does the bone get deformed? Like, is that genetic?
It can be a developmental issue in the womb, or it can be acquired early in life. For example, during a difficult childbirth featuring shoulder dystocia, which is where the baby's shoulder gets physically wedged against the mother's pelvis, the infant can suffer nerve damage called obstetric brachioplexus palsy.
Oh no.
Yeah, and because the muscles aren't pulling correctly during those critical years of childhood development, the cartilage and bone shape of the scapula actually grow abnormal.
It's all connected. The electrical signal shakes the muscle tension shakes the bone, and the bone anchors the whole arm. Which I think finally brings us to the actual heavy lifter of this entire operation, the humerus.
Yes, the humerus.
This is the long, thick bone of the upper arm.
It is the longest and largest bone of the upper limb. It interfaces with the scapula's shallow socket, the glenoid cavity, using a smooth hemispherical head. But if you look closely at the proximal end, near the shoulder, it is far more complex than just a ball and a stick.
Yeah, I noticed in the text it actually has 2 different necks.
Yeah.
There's the anatomical neck, which is just a slight groove right below the smooth cartilage of the ball. But then an inch or so further down, where the wide top of the bone narrows into the main cylindrical shaft, you have the surgical neck. Why do we need 2 necks?
Well, the anatomical neck is the true dividing line of the bone capsule. But the surgical neck gets its name because that transition zone, where the dense wide bone rapidly tapers into a narrower cylinder, is a major structural weak point.
Oh, I see.
When people break their upper arm, that is almost always where the bone snaps. Hence, the surgical neck.
Okay, that makes sense. And above that weak point, right on the outside of the shoulder, the humerus has these large jagged bumps, the greater and lesser tubercles.
Yes.
And there's a deep channel running right between them called the intertubercular sulcus, the occipital groove. These bumps aren't there by accident.
Not at all. Think about it like this. If you want to turn a tight bolt, you don't use your bare hands, right? You use a wrench to create mechanical leverage.
Right.
The tubercles are biological wrenches. They protrude outward so that when the muscles from the scapula attach to them, they have the physical leverage required to rotate the entire arm bone.
Here's where it gets really interesting. The anatomical mnemonics for remembering which muscle cables attach to which wrenches are just brilliant.
You really say that, that's for sure.
I bet. Do you remember the muscles that insert onto the greater tubercle, you think? Sally and Ingrid teach maths.
Supraspinatus, infraspinatus, and teres minor.
Exactly, SITM. And for the muscle anchoring into that deep groove between bumps,
Let's see if you remember it.
lady between 2 majors.
Here it is.
The latissimus dorsi muscle inserts right into the groove, flanked by the teres major and the pectoralis major. So you have this incredibly complex rigging system at the top, but as you travel down the cylindrical shaft of the humerus, the bone slowly morphs.
It does.
It has the deltoid tuberosity, the radial groove, and by the time it reaches the elbow, it's basically flattened out into a triangle. And the bottom, the distal end, looks completely alien.
Because its function completely changes. At the shoulder, the humerus needs to pivot in every direction. But the elbow has to securely lock into 2 different forearm bones, the radius and ulna, to create a hinge that can also twist.
You know, instead of this with army knife analogy I always hear, it really looks more like a custom machine transmission bracket. Like, it has highly specific mechanical parts designed to interface with moving gears.
That's actually a much more accurate way to look at it. There are 2 specialized articular surfaces on the bottom of the humerus. On the medial side, you have the trochleus, which is shaped exactly like a grooved pulley wheel.
A pulley wheel. Okay.
The ulna bone hooks into this pulley, creating the strict up and down hinge of your elbow. Then on the lateral side, you have the capitula, which is a smooth, rounded knob.
And the radius goes there.
Yes.
Yes.
The flat top of the radius bone sits on this knob, allowing it to spin freely so you can rotate your wrist to turn the doorknob.
The pulley and the knob. And to remember which forearm bone goes with which part of the transmission bracket, the sources gave another great phrase, crazy tubes.
Right.
The capitulum articulates with the radius, and the trochlea articulates with the ulnar. Crazy tubes.
It works. And to manage all these moving parts, the distal humerus is also flanked by 2 large bony projections called the medial and lateral epicondyles. These are the massive anchor points for all the muscles in your forearm.
Oh, so like when you clench your fist, you can feel the muscles pulling against that medial epicondyle on the inside of your elbow.
Exactly.
There are also these deep, hollowed out depressions right above the pulley and the knob called fossae. I was trying to figure out what they do, and I realized they're literal locking mechanisms.
They are.
It's like when you straighten your arm all the way out, a piece of your ulna physically swings up and clips into the olecranon fossa on the back of the humerus, locking the joint out so it can't bend backward.
Exactly. It's a bony block to prevent hyperextension. If you want to remember all these complex landmarks on the distal humerus, medical students use the phrase CITE2 freaks.
CITE2 freaks.
Yep. Capitulum, internal epicondyle, trochlea, external epicondyle, and the 2 fossa.
I love that. So we have this massive, powerful lever with a ball joint on top and a transmission bracket on the bottom. But because it's our primary tool for interacting with the world, it takes a serious beating. When this machinery breaks, the physics of the trauma dictate exactly how the bone fails, right?
Absolutely. If you suffer a hard fall directly onto your hand, the kinetic energy shoots up the arm. Sometimes the dense bone of the shaft is physically driven upward into the softer, spongy bone of the cervical neck, causing an impacted fracture.
Oh, that sounds painful.
Or if you fall and a muscle forcefully spasms, it can cause an avulsion fracture, where the tendon literally tears a chunk of the tubercle right off the bone.
What about a direct blow, like say getting hit with a baseball bat?
A high-energy perpendicular impact will cause a transverse fracture, snapping the shaft cleanly in half. If you fall and twist your arm violently, the torque creates a spiral fracture that runs diagonally down the bone.
Wow.
And a severe fall directly onto a bent elbow can drive the ulna upward like a wedge, splitting the pulley and the knob apart in what's called an intercondylar fracture.
But reading through the clinical data, the bone breaking is only half the nightmare. The humerus isn't just a structural lever, it's a conduit. It is intimately wrapped in a network of major nerves running from your neck down to your fingers. When the bone snaps, the jagged edges can easily crush or sever those nerves.
This is the real clinical danger of a humerus fracture. You can actually predict which nerve is in jeopardy based on where the bone breaks, using the ARM mnemonic.
Okay, so let's break down the ARM mnemonic. The A stands for the axillary nerve, right?
Yes.
It wraps tightly around the surgical neck. So if you break the top of the humerus, you risk shearing that nerve, which can paralyze the deltoid muscle.
Spot on. And the R is for the radial nerve. It spirals down a specific channel in the middle of the bone called the radial groove. You suffer a mid-shaft fracture, the radial nerve can get caught and break, leaving you unable to lift your wrist.
And the M stands for the median nerve, which crosses right over the front of the elbow.
Right, so a supracondylar fracture, break just above the elbow joint, can easily crush the median nerve, affecting your ability to flex your fingers. And the ulnar nerve is right there at the medial epicondyle too.
So the whole system is this high-stakes balancing act. But this brings up a massive question here.
That's
Well, we know the clavicle is a fragile bridge that snaps easily under pressure.
Right.
And we know the humerus has specific weak points and endangers major nerves when it breaks. But what about the scapula? We talked about its muscles failing and its nerves misfiring, but does the hovercraft itself ever break?
It is incredibly rare. The scapula accounts for only 0.5 to 1% of all fractures in the human body.
Really? Less than 1%?
Less than 1%. Because it is a thick, flat bone, securely cushioned between layers of heavy muscle, and pressed flat against the ribcage, it is built like a tank. It requires a massive life-threatening amount of direct, blunt force, trauma like a high-speed motorcycle crash to crack a scapula.
Wait, so the arm bone breaks and the collarbone snaps, but the shoulder blade survives?
You have to look at the mechanics of the kinetic chain. The clavicle is essentially a mechanical fuse.
Yeah.
In an electrical system, you install a cheap, easily replaceable fuse that is designed to blow during a power surge, specifically to protect the vastly more expensive and complex electronics further down the line.
So it's a biological fuse.
Exactly. When you fall hard on your outstretched arm, that massive wave of kinetic energy travels up the humerus and into the shoulder. If that energy hit a rigid, unbreakable strut, it would transfer directly into the spinal column and the delicate rib cage, potentially puncturing a lung or damaging the spinal cord.
Oh, wow.
Instead, the clavicle is designed to sacrifice itself. It absorbs the energy, flexes to its limit, and snaps. It breaks relatively easily to protect the much more complex hovercraft of the scapula and the vital organs of the chest, taking the brunt of the trauma.
That is absolutely incredible. An intricate system where one component is purposefully designed to fail in order to save the whole machine.
It's elegant in a destructive sort of way.
It really is. So, to summarize this architectural journey for you today, we started at the center of the chest, crossed the shock-absorbing suspension bridge of the clavicle, arrived at the muscularly suspended 17-engine hovercraft of the scapula, and traveled down the heavy-lifting humerus to a highly specialized transmission bracket at the elbow.
And it is a profound testament to the evolutionary demands placed upon our species. We required a limb that possessed the raw, brutal power to pull our own body weight up a cliff face, while simultaneously possessing the extreme flexibility and fine motor control required to craft a microscopic tool, or throw a spear with deadly accuracy, or paint a canvas.
Yeah.
The human shoulder and arm is the exact biomechanical compromise that makes civilization possible.
So next time you casually reach up to grab a coffee cup from a high shelf, just think about the unseen symphony occurring under your skin, 17 muscular engines firing in perfect sequence, biological pulleys rotating, and a sacrificial suspension bridge holding the entire structure away from your chest. What other invisible engineering miracles is your body performing right this exact second while you're just sitting there listening? Thank you so much for taking this deep dive with us today. Keep questioning, keep learning, and we'll catch you on the next one.